Hey, welcome to part 4 of the Go-To Physio Hamstring Masterclass. My name is Dave O'Sullivan and I'm delighted to share with you the exact approach that I've used in professional sport over the last 12 years with both international and club teams. Now, today's lesson is all about taking what we've learned from parts 1, 2 and 3, starting to put together a plan and starting to reassure the nervous system that it's safe to tolerate load with that hamstring again. As always with the Go-To Physio, we understand that the hamstring is usually overloaded, that there's something else putting excessive load on the hamstring. That's the thing we want to focus our 80% of our attention on to make sure when the athlete or the patient goes back into normal life that we've undone these issues so that the hamstring doesn't continue to become overloaded again. And that's the key to getting lasting changes. But in today's video, again, we're just going to focus on the 20% of our attention, which is the actual hamstring and the symptoms. So when we look at a low tolerance with the athlete, we want to be able to get back a situation where when we are about to send that person back into the real world, what is it that they can do or what do they need to be able to do? Well, as we said, the thing that's going to stress them the most is when they're sprinting, when that foot hits the floor, just before terminal knee extension. We want to be able to tolerate that ground reaction forces just as the foot hits the floor. We want the gastro, the hamstring, the knee, the quads to co-contract at the knee joint to give the hip an opportunity to do work. Then if we look at our graded exposure plan, we want to see that would sit somewhere around here with our sprinting, okay? So we still need these mechanics, but we can train for these mechanics all the way up the graded exposure continuum. So the exercise we're going to show you in today's lesson, that's basically giving you a low tolerance at this level. So then what we're going to do is we're going to start off. You can do this exercise pretty much. I've used this exercise day 1 post-injury, just literally as the athlete has torn a hamstring, they've come back in from the field, we've iced up, we've assessed it, and we can start them off that evening with some very, very simple variations of the video I'm going to show you today. But the beauty of this video is we are building mechanics, we're building coordination, we're reassuring the nervous system, we're teaching the hamstring to work well with all of these tissues as it needs to do when we get up to here and we have the top end speed. That's really going to stress the hamstring. So without further ado, let's get into today's lesson. Let me show you the best exercise that I found that you can do pretty much day 1 post injury. That's going to not only help the hamstring, but it's also going to help the brain, the nervous system coordinate along with the peripheral tissues to put everything into a self-organizing system so that by the time we get into the top end rehab, we've set the foundation. We're not building a rehab plan on a foundation of sand. We're building it on rock solid cement so that by the time the athlete gets here, they've earned a right to be there. So without further ado, let's look at my favorite exercise to do straight after a hamstring injury. That's going to start to build this pattern and get long-lasting results. So as part of the assessment, we may go into some more advanced assessments depending on what you found to date. And again, the new grad sports physio side, all I want this to be is something to stimulate your brain, open your mind to different thought processes and help you develop your own style or way that works for you, okay? Now, in the mentorship, we go into a bit more advanced assessments and we'd kind of look maybe a little bit more in depth at the hip or whatever else we thought was contributing to this based on the athlete's story. But one exercise that I think a lot of athletes would benefit from regardless, okay, of whether it is a genuine trauma to the tissue or whether it's maybe we think that something around the hip, etc., is contributing to this pain experience, is an exercise where I like to get the athlete pushing through the midfoot, okay? And I would do this exercise pretty much day 1 after an injury, okay, as soon as possible. So what I'm going to get Pete to do, and it's very, very easy, is Pete, I want you to imagine that there's an orange under your midfoot here for me, okay? Now I still want your toes to push through the floor, but I want your intent to push through the midfoot for me, okay? And all I want you to do, Pete, as you inhale slowly through your nose, is I want you to build tension, okay? So imagine that there's an airplane taking off and you're just building tension through the floor. So I don't want you to go from 0 to 100, I want you to take about a good 4, 5, 6 seconds, let's say 6 seconds, to build up to that point where you feel you have your contraction, okay? If you get any pain, I want you to just go below that pain level at the moment, okay? So Pete, I just want you to push through. Now, what I would do sometimes is I will actually put my hand under that midfoot to give them that proprioceptive awareness. Now, squash an orange, Pete, and I'm gently just going to lift a tiny bit so that he has to push, okay? A lot of people, they're going to be used to pushing through their heel, but we want that intent through the midfoot, okay? So push through the midfoot again, Pete. Build tension. Good. Now, a lot of athletes, what they're going to feel like, okay, my hamstring feels like it's going to cramp, or they might say something like, I can't really feel it anywhere, I feel it in my calf, okay? Now, the whole point of this exercise is that I want to give Pete back options, okay? So when I get Pete to push through the heel, okay, we're going to bias usually the hip, okay? So if you push through the heel, Pete, what we're going to usually feel is the top of the hamstring. Can you feel it working there a little bit? If I push through the toes, we're going to generate a torque predominantly around the quad. So if you push just through the toes, Pete, you feel like this is going to start to work. Whereas the beauty of this is if I push through the midfoot, I'm going to get the hamstring to generate torque. I'm going to get the gastroc to generate torque because that's going to stop knee extension. But yet we're still going to have some bit of quads working, and we're going to have some bit of hip extension. So it's a nice exercise just to get everything working together again, restoring, reassuring the ability of the whole system to generate torque, because I don't want one muscle to generate torque. I want everything to generate torque to help and do its job based on the demands that's being placed upon the body in the here and now. So this is a good exercise because as we push through that midfoot, that hamstring is going to have to generate torque. It's going to work under isometric conditions at about 5 or 6 seconds as Pete continues to build tension. And then what we want ideally is we want to feel tension in the glute as well. So we want Pete to be able to generate tension here. When that hamstring is working isometrically, then hopefully it's going to start to transfer some energy up into that hip. So just build tension again, Pete. And again, the athlete day one post-injury, or even if the athlete's come into me straight from the training ground and he's done this like literally an hour ago, I will usually give him this exercise pretty much straight away to start with. Now this is good because it just reassures the system that it's safe to put a force through the tissue ASAP again, okay? And very often then what we'll find is he can build a bit more tension. He can do it without cramping, or he can do it without pain. If he gets any cramping through the hamstring, etc., he's probably putting too much force through it, or we need to build up the tension slower. So it's giving us a lot of good awareness of these tissues again. It's bringing back his awareness to the tissues. He's getting a bit more feel of the tissues co-contracting rather than one tissue working excessively. So it's a brilliant exercise that I really, really like. It looks very, very easy, but don't underestimate the power of this exercise. Now, in the mentorship, we might make it a little bit more specific depending on what we find with our assessment and a bit more in depth. But certainly for now, I would encourage you to use this exercise with an acute hamstring injury because it works very, very well. And even with more of the persistent cases, just even starting at this level and reassuring the brain that it's safe to push through the floor and generate torque in all different directions. Because in that scenario, his calf, his soleus, gastroc, hamstrings, quads, glutes, they're all going to work together to generate tension. And having that low level, sub-maximal building tension from a mindfulness point of view and giving him awareness of these tissues is very, very powerful. And then the other thing that I get Pete to do is I get him to inhale slowly, okay? So Pete, I want you to slow the air in through your nose as you build tension. So as Pete concentrates on the air coming in through the nose, we just bring a bit of mindfulness into it, which will hopefully then dampen down the limbic system as well. That could be contributing to this threat response that's ultimately contributing to this pain experience, okay? So again, we're just dampening down that limbic system a little bit, bringing a bit of awareness to these tissues and just encouraging all these tissues to generate torque together rather than trying to isolate one thing versus the other, okay? So it's a really nice exercise. I'd encourage you to use it as soon as possible. You can do it on both legs. Again, if you feel any cramp and any pain, just back off and just build tension to the point before that comes on, okay? And again, he'll improve his awareness very quickly and he'll be able to feel then that he can generate tension at the hip through the hamstring very, very quickly after, you know, a few goes, a few sets, a few reps, or it might take him a day or two, okay? So that's something I'll be particularly interested in. As I said, I think it's a great exercise and it's very valuable because we can do it pretty much day one post-injury. Okay, so I hope you enjoyed today's lesson. Now, Today's lesson is very, very important, and as always, if you want to know more information, head over to www.thegotophysio.com. But I want you to think about a couple of things now. In your rehab program, whether you're in the gym or whether you're teaching athletes to do glute bridges, what are you teaching athletes to do? Are you teaching athletes to push off the heel, or are you actually helping athletes, said another way, to use the proximal gastro and distal hamstring? I see a lot of therapists and they're cueing their patients push through the heel with a glute bridge. Okay, they'll actually get people to dorsiflex the ankle and try hip extend. Have you ever tried to hip extend when you walk by pushing or try pushing off the heel? Okay, what you're going to do is you try to push off the heel is you're going to have to arch your back. When you arch your back, you're putting even more tension on the hamstring. Okay, so when we hip extend, we get the weight going onto the midfoot and forefoot. That's just neurologically how we're hardwired. Okay, so it doesn't make any sense to me to teach athletes to try hip extend by doing glute bridges pushing through the heel. In another video, I'll talk to you about how I cue glute bridges, but for now, I really want you just to take a minute and consider what you're doing on a day-to-day basis. Are you reinforcing bad patterns or bad movement habits or bad movement skills with your athletes by the cues that you're giving them to use? If you want to know more about this, head over to thegotophysio.com. I've got loads of free resources there for you to get your head around this so that you can get your athletes back building a rehab plan with a foundation made of cement rather than sand. Okay, so that's it for this week. Coming up in the next lesson, I'm going to share with you some more progressions that we would do. Now that we've started to build that foundation on cement, let's start progressing our athletes through a higher level of load tolerance.